Welcome if you're just joining us on Facebook. We're starting in just over 3 minutes, and today our guest is Stephanie Shendale from the World Health Organization headquarters. We're going to be talking about strategies for catch-up vaccination in the context of COVID-19. So thank you for joining us. You can share this post, share this video already if you have colleagues that you think might be interested in this. And of course, if you want to share some love and give some either thumbs up or hearts and also introduce yourself, leave your questions. We're looking at all your comments. The first one up is Amel Altahir. So welcome, Amel. We'll be speaking to you soon. And we also have with us Dr. Tanushri Mandal from West Bengal, India. Welcome to you as well, Tanushri. We'll see you in 2 minutes and 30 seconds. Warm welcome from Geneva, Switzerland. This is Reda from the Geneva Learning Foundation. This is today's live stream as part of the COVID-19 Peer Hub. We're speaking with Stephanie Shendale from the World Health Organization headquarters. Welcome, Stephanie.
Hi, Reda. Nice to be here. Hello, everybody.
And the topic today is on catch-up vaccination. No one should miss out on the right to the protection that vaccines offer simply because they're unable to access services in time. With me, of course, is Charlotte. So Charlotte, I'm handing it over to you to lead the interview with Stephanie to learn more about catch-up vaccination. And for those of you who are following on the Facebook live stream, please do share your questions. Of course, you're welcome to introduce yourself, tell us what city and country you're connecting from. But if you have questions about catch-up vaccination, I'll be rudely interrupting Charlotte so that we can ask those to Stephanie Shendale and get some practical answers to your concerns around this issue. Charlotte, over to you.
Thank you very much, Reda, and good morning, afternoon, evening to everyone that's joining us in this live session with Stephanie Shendale from WHO, and it's always a pleasure to have you with us. So I'm going to turn towards Stephanie and straight to the point because I have lots and lots of questions for her today. So Stephanie, please, can you tell us what you do at WHO HQ and how does it make a difference?
Hi, Charlotte. Yes, of course. So my name is Stephanie Shendale. I work in the Essential Program on Immunization at WHO HQ in Geneva. And I'm on the Life Course and Integration team. And a lot of the work that I do at WHO is around strengthening platforms for immunization delivery beyond the traditional infant vaccines. So into older age groups, the second year of life platform, for example, booster doses to older children of things like tetanus and diphtheria, for adolescent vaccination, school delivery of vaccination and vaccination checks, and of course, catch-up vaccination. So it's really about promoting the idea that vaccines are not just for infants, as traditional immunization programs used to be, but really it's about vaccination across the life course.
And what is catch-up vaccination and why is it particularly important within the context of COVID-19?
So when we talk about catch-up vaccination, we're really talking about vaccinating an individual who has, for whatever reason, missed out on a vaccine dose that they were due as per the immunization schedule in that country. So of course, timely vaccination is very important, and immunization schedules are designed so that people are protected as early as possible against vaccine-preventable diseases. And we really want to promote, getting your vaccines on time for sure. But we also know that there are a lot of different reasons in various contexts why individuals might miss out on those scheduled doses. And so catch-up vaccination is really referring to the ability of a program to offer those vaccines at a later date to those individuals. Of course, COVID-19 is presenting challenges that are unprecedented in a lot of places, and health services are being severely disrupted in some cases. And as a result, people are not able to access their vaccines on time. So we're having really an exacerbation of this issue where people can't necessarily get there on time. But of course, they're still eligible for these vaccines. They're still due. And we really want to make sure that systems have practices in place to enable those individuals to catch up on any vaccines that they might have missed because they weren't able to access health services due to service interruptions as a result of COVID-19. So it's really putting a spotlight on this issue, even though I really do want to stress that this is a situation that is applicable before COVID, after COVID, and across the board with immunization programs. And so it's not specific to the COVID-19 pandemic, but it is really being highlighted as a result of it.
Yeah, you just answered the question I wanted to ask because it's as though the concept of catch-up vaccinations never existed before. All right, so can you tell us briefly about the catch-up vaccination guidelines and who are the primary beneficiaries of this?
So the catch-up vaccination guidelines that have just recently been published by WHO, the link is provided, I believe, below the chat today, and of course afterwards we'll make sure that's available. But these are new guidance. This is a new guidance document that it really talks about the different programmatic and policy considerations that should be in place across the board for immunization programs to make sure that the systems are designed in a way, as I said, to enable late vaccination, essentially. If somebody isn't able to come on time and they come later on, we want to make sure that the systems are in place to make sure they can still get vaccinated. And so this guidance covers all the different programmatic considerations across aspects of the immunization program to address that. The second half of the guidance talks about special circumstances where service delivery might be interrupted more significantly. For example, as we're seeing now with the COVID-19 pandemic, but also sometimes this comes up due to natural disasters, conflict situations, mass population migrations. There are a lot of different reasons why services might be interrupted for either a short or a long time period. And so the second half of the guidance talks about some extra things that programs can consider putting into place to address these larger immunization gaps. And the target audience for the guidance is, like most WHO guidance documents, it's really targeting immunization program managers, policymakers and decision makers in countries. So for example, the National Immunization Technical Advisory Groups, which often play a key role in advising on changes to policies or schedules within the countries. It's also, one of the target audiences is our immunization partners in countries who have a really important role to play in advocating for some of these policy and programmatic changes that need to take place. And then, of course, even frontline health workers will probably find this interesting and helpful for them in their service delivery, because it talks a lot about sort of how to assess eligibility of a child or an individual who comes and is maybe missing some doses. It provides links to the WHO guidance on minimum intervals between vaccine doses. And there's a lot of good information in there that I think health service providers will also find quite interesting.
You keep providing answers to my questions before I ever ask them. I think that's great, but I'm still going to talk about individuals, children. So does it mean anybody, even at 90, could be eligible to a catch-up vaccine?
So this will really depend on the vaccine, of course, and it also depends on the national policy. And so, maximum ages, upper age limits, this will be different depending on the vaccine. And WHO has recommendations for all vaccines and recommended schedules. And the link to that is also in the chat, and we'll make sure that you have that available as well. But WHO recommendations are based on safety and efficacy. I mean, the recommended schedules that WHO puts forward is so you can maximize the immunogenicity of the vaccines. Actual vaccine schedules in countries, including upper age limits, if there are any, are based on national policy decisions. And so that will take into account epidemiology in the country and the burden of disease. And so it really differs widely across countries and across antigens. But the main message to take home from this is that, at least from a WHO recommendation perspective, it's never too late to vaccinate for the most part. And we really want to make sure that nobody is turned away because they weren't able to come on time. And so this is something that we're really encouraging countries to look at when they're looking at their immunization schedules and designing catch-up schedules, to really make sure that they're looking at, what the situation is in the country and when these individuals will still benefit from vaccination. And in most cases, for most antigens, that will continue beyond what is sometimes, unfortunately, the upper age limit that's put in place in the country.
Thank you very much, Stephanie. Now we talk about catch-up vaccination, ensuring that maybe everyone who demands an immunization service gets it. The aspect of vaccine availability, comes up. And so what can be done? How do you mitigate the risk of vaccine stockouts while implementing this strategy of catch-up vaccination?
That's a really good question, and it's definitely one that I hear a lot, comes up a lot of times in conversation when we're discussing, extending the eligibility beyond what is, currently the policy in some places. And it's a valid concern, because I know that vaccine forecasting is done differently in different places, and in some places it's done really based on previous consumption. So if you have a program that's normally only used to hitting 80% of its target population, and then they forecast their vaccines based on that. Once you extend that age eligibility, you might run into an issue of, increased consumption at the beginning when you're first, extending your eligibility window. And so that's totally understandable, and it's to be expected. But also we recommend having a buffer stock, a buffer percentage on top of your forecast. And so usually that should mitigate any increase in consumption that's experienced in the early months of introducing these policies. And then the recommendation is to just revise your forecasting based on actual consumption. So as you move forward, this should stabilize. But the main message is to keep in mind that every individual that you'd be offering catch-up vaccination to was indeed entitled to that vaccine in the first place. If you're looking at your target populations for vaccination, all of those should ideally, in a perfect world, be getting vaccinated on time. Your 100% coverage is what you're aiming for. And so offering catch-up vaccination to someone who missed out on that dose in the first place is not really extra vaccine per se. It's really just the vaccine that they, were entitled to in the first place. So it's not, programs are concerned about using extra vaccine if they're introducing catch-up, but we really want to reinforce the message that these are vaccines that these individuals were eligible for and due in the first place. So eventually your supply should stabilize when you're just monitoring your actual consumption on a monthly basis.
Thank you. And Reda just indicated that we have our first question on Facebook. So we'll turn towards Reda now to read out the question to Stephanie.
Thanks, Charlotte. So we have Dr. Tanushree Mandal, a frequent guest and participant in these lightning chats and the Ideas Engine live sessions. So really two questions. How is the catch-up vaccination going on in the context of COVID-19 pandemic? Has there been a change in the strategies? And then also, she'd like to hear some success stories if you have any to share.
Okay, that's a great question. It's a hard question to answer in a few sentences or less, because the reality is that just as the pandemic is affecting health service delivery very differently across the globe, so are the strategies for catch-up that countries are putting in place. And a lot of countries already have very well-established catch-up practices and policies within their program. So these countries have had, in a way, a bit of a head start. If it's already a well-established practice to be able to vaccinate late, then at least they don't have to worry about changing those practices or attitudes in the country. It's just about getting individuals, to feel comfortable enough to come back into services. So whereas on the other hand, some countries who just don't normally do this, they are now faced with a situation where they not only have to address, gaps of unimmunized individuals, but also, perhaps thinking about revising policies on the fly if there's upper age limits that need to be temporarily lifted, for example. So it is looking very differently in different countries, but we do have some really good examples of countries that have managed to already bring their coverage back up to levels that it was before the pandemic, just through sort of intensifying the routine service delivery and putting into place sort of, as I said, intensified efforts to get people back to the health services and get these vaccines that they're missing. So, targeted communications campaigns can be really effective, using all sorts of media, social media and traditional media, to get the message out there that, services are on, they're running at these times, they're safe, and there's COVID measures in place, and to encourage people to come back to the center. That's actually been working quite well in a lot of places. We also see some different, more innovative strategies for catch-up vaccination employed by some countries, where they are setting up outposts for vaccination away from health centers, so that if people are concerned about getting exposure to COVID by coming into a health center, they can get their vaccinations in marketplaces or in schoolyards, in churchyards, where they're setting up safe delivery. There's also been examples of drive-through immunization that we've seen in some places, so people can stay in the safety of their own car. Of course, that's not going to work everywhere, but it is actually being done in some countries. Even door-to-door immunization is being done in some countries. Again, it depends on the capacity of the health system to be able to do that. But I know in some countries they're doing it by appointment, and the health worker will actually come to your house and vaccinate. So it really varies widely across the board, but we're seeing a lot of really good, innovative strategies put in place to address these issues.
Okay, so thank you, Stephanie, and thank you, Dr. Tanushree, for that question. Unfortunately, we are 1 minute to the end of the session, and there's one more question on Facebook, and I still have my own one more question.
And we're also going to tell you, if you'd like to find out more, there will be we posted the links, some of the links in the comments in Facebook. And I'm also going to show you a great next step if you'd like to learn more about catch-up. But the last question, actually, is from, unfortunately, I'm unable to read the characters, but that's a lovely little child in your profile photo. Says, can we lift the upper age limit to catch up every child who missed during COVID-19 and went beyond the age limit? That's a practical, there may not be one size fits all answer. What would you be able to say at this point, and how can you, what would be your advice there?
What I'd like to say is, obviously that's not my decision, that's the country's decision, but that is the recommendation. We would like to see that happen, because the worst thing that we can imagine is that somebody ages out of their eligibility window simply because COVID has prevented them from getting that vaccine in time. And that is just a situation that we just don't want to see. We don't want to have people missing out on their vaccines simply because they couldn't get there in time. And so 100%, that is the recommendation that we want countries to be taking into under consideration, that look at the length of your disruption and what that might mean for people in their eligibility window, and please lift any age restrictions if you can, because we really don't want to have people missing out on their opportunity to be vaccinated.
Great.
Okay, so thank you very much, Stephanie. And just 30 seconds for this last question. Many mothers and caregivers, they fear multiple injections. How do you handle that? Because it will probably come up with catch-up vaccination.
Yeah, Charlotte, that's an excellent question. And again, one that we definitely have seen before and will continue to see. And this might pose an added challenge with catch-up because you might be faced with a situation where you need to even be offering additional injections at that same visit, even more than the regular schedule. And this is a valid concern. I think the important message to convey here is that as long as the health workers themselves feel empowered and equipped to address these concerns with parents and feel themselves comfortable with administering multiple injections in the same visit, then they should be able to address those concerns with the parents and let them know that, the reason that we offer multiple injections at the same time is really to, avoid having to return for additional vaccines and getting the child protected as early as possible. And multiple injections are safe and effective, and we have a lot of good resources on the WHO website, which again, I'll link at the bottom, to help with training and communications techniques so that health workers feel comfortable to convey these messages to parents.
Great, thank you very much, Stephanie and Charlotte. I promised you that we would be sharing what would be a great next step if you'd like to share, to learn more about catch-up. So Stephanie, together with some other colleagues from WHO, did a special event yesterday for the participants, for the learners in the Global Routine Immunization Strategies and Practices course. And we've just put that the recording of that special event on YouTube. So we'll be sharing that link as well. And it's 1 hour, 40 minutes. There's some great content as well as discussion and dialogue around that event. So if you'd like to learn more, don't stop here. The next step could be one to go look at the guideline that Stephanie shared specifically on catch-up vaccination. Look at what your Ministry of Health already has in terms of resources and recommendations and plans in this on this question. There's a lot more ways to go further for those of you who are ready to do so. That's it for today. Thank you so much, and we look forward to seeing you on Facebook. Looking forward to more comments and questions. We know many of you are watching these after watching the recording. If you could make it live, that's even better. But if you watched the recording, thank you, and we look forward to continuing the dialogue with you. And thank you to Stephanie and to Charlotte. Bye-bye.
Bye.
All right, and I just see the number of hearts and thumbs up going up. Already 62 hearts and 39 thumbs up. Thank you. Thank you to Abdallah Malin and all of you who attended today. Goodbye.